Tragically, I am reporting today that 7 more people are been added to the number that have died from COVID-19. That will bring our total count in the city of Houston to 329 Houstonians who have now lost their lives as a result of the virus. The 7 newly reported deaths and their ages are listed on the monitors. 6 of the seven were Hispanic individuals, including one in his 40s and another in his 50s. One of the deaths was an Asian female. So again, there's 7 more who have died as a result of COVID-19, the total count now being 329. COVID-19 continues to affect our families, friends, neighbors, and co-workers, and that's why, as a city, we are asking everyone to continue to take this virus very serious so that we can do everything we can to slow the progression of this virus in the month of July. That is our goal, to flatten and to start reducing this curve in the month of July. In order to achieve that, we're going to have to work collectively and be very intentional about putting on these masks and engaging in social distancing. The virus does not care if you're young or old, rich or poor. COVID-19 is also taking a toll on the city of Houston workforce. The number of employees with COVID who are in isolation and cannot report to work has steadily increased. 224 municipal employees, and these are employees excluding police and fire, have tested positive of COVID-19. When people are sick, recovering, or in isolation, they cannot work. That means your city services may be impacted. We are doing our best for trash pickup, with street repairs and permitting, but the services, of course, are being delayed because of what we're having to face, our employees are having to face. To bring the point home, I want to bring up Houston Public Works Director Carol Haddock, who last week lost 2 employees in a 24-hour period to COVID-19. Carol.
Thank you, Mayor. My name is Carol Haddock. I'm the Director of Houston Public Works. This past Friday, I received word that 2 of my colleagues in Houston Public Works had succumbed to COVID-19. Both logic and statistics told me that we should have expected to lose a coworker during this pandemic. However, when those statistics become names, it's personal. Today, we mourn the loss of Natarvia Robertson and Michael Sanchez. These 2 colleagues were essential employees, reporting to work every day to support Houstonians. Houston Public Works and the City of Houston continue to provide basic services that keep Houstonians safe during this pandemic. We provide safe drinking water, and we take away your wastewater. You can wash your hands for 20 seconds because this water is available at the turn of a faucet. We make sure that your storm drain systems are working and that our streets and traffic signals are operational. We make sure that construction, whether our public infrastructure or your homes and businesses, is designed and built to keep you safe. Our colleagues in solid waste make sure that your garbage, recycling, and heavy trash is collected. In short, we are essential to keeping Houstonians safe during this pandemic, but being an essential employee comes with risks. We must leave our homes every day to provide these services. We have an increased risk of coming into contact with somebody who has COVID just because we've left our homes to serve you. Yes, we have adjusted the way that we do business on a daily basis during this pandemic. We have allowed telecommuting where we can. However, for around 3,000 of our 4,000 employees, telecommuting just is not an option. It's not possible to run a treatment plant from your home office, or to unclog a stormwater drain pipe from your living room, or to repair a broken water main if you aren't physically there to repair the pipe. And since we must come in, we have done many things in our operations. We've started our reporting times. We take temperatures of every person entering one of our facilities. We require that everyone wears a mask. We send extra vehicles to job sites so that we don't have more than 2 people riding in a truck. We provide hand sanitizer and have installed plexiglass shields. We've taken over conference rooms for offices and to serve as break rooms so people can be physically distanced. We've arranged for field crews to go to neighborhood police or fire stations for restrooms and for access to water, since most of the places we normally use aren't available today. Yet even with these measures, more than 5% of our team is out of the office today, either having tested positive for COVID, waiting for test results, or in quarantine because of an exposure. This means that it will take us a little longer to repair that water main break or to clear that ditch or to process that permit. Friday, we lost 2 colleagues. They were essential employees providing essential service to Houstonians. But they were more than that. Tarvia Robertson will be greatly missed by her family and her extended family. Michael Sanchez was a husband, a father, a brother, and a son. And the family of Michael Sanchez wants Houstonians to know of his passion for serving this city. The entire Houston Public Works family asks that you lift up both of these families and our entire department during this time. And I want each of you to know that the men and women of Houston Public Works will continue to show up every single day to make sure that we are providing those essential services to Houstonians. And next time you turn on your faucet and safe drinking water comes out, think of our city employees out there providing essential services and say a quick thank you. But even more important than thanking us, help keep us safe by not going out when you don't need to. And if you do have to go out, make sure that you're wearing your mask. Thank you.
Let me thank Director Haddock, and please bear in mind that these are essential employees. These are the people, for example, that are making sure that while you're at home or in your business, when you turn on the water is coming on. These are the people, for example, who engage in our street rehabilitation program. These are the people who are picking up your trash. They are essential workers. They cannot work remotely from home. And quite frankly, even when their colleagues are coming down with the virus and others are having to quarantine, these are the employees that continue to be on the front line. So I would ask that please be understanding if there are some delays that are taking place in the city. The city employees are not immune to what is occurring out in the community, and it provides an added reason why it's important for people to put on their masks and to engage in social distancing. Let me bring up Chief Pena with the Houston Fire Department to talk about what's happening in his department. Chief Pena.
Thank you, Mayor. First of all, I'd like to express my condolences to the 2 Public Works employees who succumbed to this virus. We also have a firefighter that's in intensive care right now. Captain Lucio is in intensive care in a hospital in San Antonio, continuing to fight for his life. He is in critical condition. We ask that this community, again, keep lifting Captain Lucio and his family up in their prayers because they are going through a very difficult moment at this time. In regard to our personnel in quarantine, today we have 162 firefighters that are in quarantine. Of those, 38 are positive for coronavirus. In the extent of this operation, we've had 189 firefighters who have contracted coronavirus. 151 of those are back at work, so we still have 38 that are positive. We maintain, in the last 24 hours, in regards to our occupancy task force, we've responded to 48 complaints for perceived violations of the governor's order, and we're able to mitigate each one of those incidents on the spot. So again, a credit to our inspectors and a credit to the business community for the work that they're doing. I would like to take this time to clarify some misinformation that's floating around on social media in regards to the status of the fire stations. There are no fire stations that have been closed. Regardless of what's been put out on social media, all fire stations remain open. Again, today we have 162 firefighters in quarantine and another 48 that are off on some other leave. Very difficult to staff when you have that many people sidelined, but we're doing everything we can to ensure that the units, every unit that we have available is staffed. Okay? Thanks to the firefighters and the hard work that they're doing. Thank them for pulling the extra duty. But we are staffing 100% of our ambulances. We're staffing 100% of our fire engines. and at no point have we fallen below 90% staffing of our aerial apparatus. Okay? So I want to clarify that and make it perfectly clear that there are no fire stations that have been closed, because I know that there's been some misinformation being circulated on social media, and that is furthest from the truth. We are being challenged regarding staffing. Every department in the city is. Our employees are out there. We're being impacted by this community spread of the virus. As the mayor mentioned, we are not immune to the virus as well, so it does impact personnel. But we are doing everything we can with the resources that we have available to ensure that we're providing the service and that we're there for the community when they need us. Okay? That's my report. Thank you.
Thank you, Chief. I want to thank our firefighters, I want to thank our municipal workers, and I want to thank our police officers. And one of the reasons why we hold these press conferences on a regular basis to make sure you get correct information, because that's critically important when we are dealing with a pandemic. Misinformation doesn't serve anyone's purpose. Over the weekend, Houston lost one of our prominent citizens and restaurant owners, Vincent Bubba Mandola, who died on Sunday, July the 19th, due to complications with heart failure. His family tells me that he did contract COVID-19 in June. However, he passed away from heart failure. We certainly want to remember Vincent. For many of us who've been to at least one of the several restaurants, we know what a business person, family he comes from, and Vincent will always be remembered. And so we want to take this moment to pause on behalf and to remember Vincent Bubba Mandola will be deeply missed, and to his family we want to continue to lift them up in our thoughts and prayers. And now at this point, let me bring on Dr. Peirce.
Thank you, Mayor. Dr. Haddock, sympathies to your entire department as well as the families of those who passed. We've been talking about how the virus is spreading. We have some data we've been showing, trying to keep the public up to date. And this graph shows the positivity rate. So again, this is the percent of tests that are done, and of those tests, how many are coming back positive. And you'll see we are remaining to hover. Looks like it's a little bit of a downtrend, but that's actually less than a 1% downtrend, from 25 to 24+%. The yellow bars are the number of tests are done. The red are the number that came back positive. And the number is very high. So it is too early to suggest that this is really a flattening of the curve, although I can see where some people would say that. I'm just a little bit too cautious to say that just yet, because the virus continues to spread. Now, everything that we do as Houstonians, to wear masks and to keep ourselves separate from others, helps. So that may be what we're seeing here, but I'm just going to wait a little bit before I say anything more definitive. In our next slide, similar to what we've shown in the past by zip code, are those neighborhoods that have got the higher rates. And on this map, the darker the blue, the higher the rate within that zip code. And you see for those that are the darkest, it's more than 30%. That's a very high rate. Now, if you remember the slide that we showed last time, about a week ago, it was slightly different. And the colors were the same, the legend was the same, but the zip codes were different. And I said back then that this isn't evolving. This is like taking a single frame out of a movie. The colors will shift across the community as the virus spreads across the community. So those are the zip codes that today have got the highest, and they are actually not terribly far from where they were last week, but they will continue to move. Nevertheless, the virus, and those that are lightly colored does not mean that there's no virus there. All right? So don't be, because the white, the lightest color, is just down to 20%. So that's still 1 out of 5. So there's still a lot of virus in the community. So read the chart, this map, for what it really says. And what it shows is that there is lots of virus spread throughout our community. And some zip codes are just a little bit hotter than others. All of this is preventable by wearing a mask. Don't go to large gatherings. Don't hold large gatherings. Stay 6 feet away. Wash your hands. Thank you.
And the point I want to make is, and I'm getting ready to take questions or comments from anyone, is that this month I'm asking people to be very intentional, very focused about putting on these masks. Please, that's one of the things I want to emphasize, that city employees, that are people that are outside of our city, that's where, regardless of where you're going, if you're going to some sort of event or meeting or wherever it may be, I'm asking people to please, if you're in the presence of someone else outside of your home, please put on your mask. And quite frankly, if you're in your home and there are people coming in and out of your home where you don't know where they have been, I'm going to ask that you put on your mask. I'm going to ask that you engage in social distancing and make sure that you're washing your hands or using sanitizer. Let's be very intentional for this month. And if we work together, I think this month, over the next week or two, we ought to, hopefully we'll see positive results, and not only flattening, but hopefully the number will start to come down. And again, the goal for us is to reduce the number of people going to our hospitals, reduce the number of people needing ICUs, ventilators, you name it, such that our healthcare delivery system is not overwhelmed. So that's our goal, regardless of somebody, whether or not there is a shutdown, no shutdown. I am asking Houstonians to take it upon themselves to do what they know we need to do collectively in order to win this battle against COVID-19. Having said that, we'll take any questions or comments.
Mayor, just wanted to follow up a little bit on now that the Republican convention part of it is over.
Yes.
Have you looked at the numbers and thought about? I know you canceled everything city-related for July, but there's still stuff in the books for August. You know, at the GRB and various other activities. Do you anticipate canceling all of those as well, or where are you looking at?
I know for city permitted, produced, sponsored events, most of those events will be canceled for the months of July as well as August. The events that will take place that are city sponsored will be, for example, the mayor's back to school event, but that's being totally reimagined. Instead of it being hosted at the George R. Brown, for example, where we're bringing 25,000 people together, that will be a drive-by at the NRG on August the 7th and August the 8th. And that will be done in collaboration with the Houston Food Bank. We'll be passing out food, masks, as well as backpacks and school supplies. So we've totally rearranged that. For most of the other events, like parades, you name it, those are being suspended.
But do you anticipate being able to rent out any city facilities, or you're not going to rent them out?
There are no. I've even talked with Houston First. There are no major events that are being planned in the month of August. I think the first one that may be of any sort of size may be in September, but I don't think there are any major events planned in the month of August.
Can you talk to us about, I know you talked about this before, but the challenges of contact tracing when the numbers are above 300? Because we're still hearing stories out in the community about how it's not working very well, I guess.
Well, there are two problems that we're facing. One is getting the lab results back from testing within let's say 3-4 days, because when we're using these big national labs, LabCorp and what's the other one? And Quest Labs, is taken in some cases 2 weeks or more to get back the results, and that makes almost those tests useless. And so that's one problem. The others with the numbers, when the numbers are like over 800 or 700, like what I gave today, it's very difficult for the contact tracers to be able to follow through, to contact, isolate, identify, treat those individuals. And so the goal for me, what I've said, is that we need to get that number down from 800, for example, down to 300 or below, to make it possible for our contact tracers to be even more effective. We have about 230, 240 right now. The goal is to go up to 300. Quite frankly, we need even more of those. And so we're looking at various ways on how we can reach more people. But when the numbers are 800 and what did I give out? 884. It makes it on a daily basis. If they're hovering around that number, it just makes it very, very difficult for a contact tracing program to be effective without hiring thousands of individuals. Dr. Persh, you want to elaborate on that?
Yeah, the mayor's exactly right. The volume is enormous. So a couple of things that people can do, instead of us talking about what we can't get quite done, but what we can do is that certainly if you went to get tested because you think you were a contact of somebody who you know to have been positive, whether it be a family member, a coworker, neighbor, If you think you've been exposed and that's why you went to get tested, you should just assume that you've been exposed and quarantine yourself until such time as you get the test results back. Certainly if you went because you've got symptoms, you should isolate yourself. It's functionally the same thing as quarantine, but you should isolate yourself at home and monitor your symptoms. And if you get sick enough, call your physician or go to one of the neighborhood clinics to get to find out if you're sick enough to require hospitalization. So those are things that we can do. In addition, if you are symptomatic and you went to get tested, you can do your own contact tracing. Because really it's for we look to about 48 hours before your symptoms began as to when you start, we believe that people start shedding virus. So you could actually do your own contact tracing and think hard about who you may have exposed before your symptoms began and advise them to quarantine and or go ahead and get themselves tested. One last thing is that, we talked about this last week, is that when we're doing the case investigation, you will get if we send you an email, it's going to have there'll be Houston Health Department or Houston Health at Qualtrics. So look for the word Qualtrics. That's us, and that's part of the case investigation. Because we're calling people, we're sending emails, and we're sending text messages.
And while you're here, Dr. First, maybe you and the mayor can both talk about this. We talked to the folks at Morales Funeral Home today, and just for their slice of life, they saw double the number of deaths this last month than the month before. And I know we've seen some rise in your daily death count, but they were saying that they think it's still even higher, just from what they're seeing on the ground. Where do you think the death rate is, and are you concerned that the lag is not any better and that we might see a big jump at some point?
So yeah, you're actually touching on a couple of things. This is it's a complicated question, but it's a good question. So the reports that we give of people who have died related to COVID are the ones that we know because we've got the death certificate, which includes the physician's statement that there was a COVID-related death. And the lag is very often, that has to be done within 10 days of the death. The lag, because sometimes these are a month or more behind, right, is because then the funeral home and the family have to get together to finish that. There is no mandated deadline on that. So sometimes it takes longer for that to get done. But you can imagine families sometimes struggle with a lot of things that are going on when somebody dies, especially when it's an elder person. It tends to be the leader of a family. So there's a lot of stuff that goes on. So that's why we're sometimes behind. I feel confident that within Harris County, that we are not missing any COVID-related deaths because our medical examiner is what I describe as an academic medical examiner's office. So every death that occurs, whether it be at home or in the hospital, gets a death investigation to the degree to determine if the medical examiner wants to pursue it as a COVID-related death. So is it possible that we've missed some? Yeah, maybe, but I don't really think so. Because, like I said, this medical examiner is being very aggressive in the case investigation of each of their deaths to determine whether it's COVID-related.
Mr. Mayor, I have the pool questions, if that's
Sure,
okay.
sure.
First one from Channel 26. Major League Baseball games start this week. Would you like to see Astros fans in the stands sometime this season, despite COVID?
Oh, yes, I would love to see Astro fans in the seats. I would love to be in the seats myself. But in order for that to happen, we are going to have to be intentionally focused on reducing the community spread today, like yesterday. So if you want to see people in the fans, if people want to see themselves in the fans safely, then they're going to have to put on these masks right now. And they're going to have to engage in the social distancing. All of the things that we know work against this virus are the things we're going to have to do right now in a very focused, intentional, collective way. So I want to see fans in the stands. I want to see our kids in school. I want to see businesses to remain open and to flourish again. But in order for that to happen, we're going to have to take the fuel and the energy away from this virus. And the only way we can do that is to put on these masks and do those things in the months of July as well as August.
Do you think there's a safe way to get fans into the games?
I think there's a safe way.
Yes, sir.
There are no fast cuts with this virus in the absence of a vaccine. They're just not a safe way. I mean, yeah, can you social distance people quite a bit? Yes, you can. Okay. But all I'm simply saying, in order for us to get to that point, There are some things we just need to do right now. There are no quick ways to do it. I think what's on the screen is important. I mean, you see Simone Biles, you see Carlos Correa, you see Slim Thug, you see Denzel Washington. Oh, I'm sorry. That's me. You know, some people get me confused with Denzel Washington, but no, but that's me. All with the mask on. Those are the things that we need to do and take this virus very serious. And quite frankly, I mean, going back to what Mayor Shea had to ask about contact tracing, the best way to follow up and make contact tracing to be effective is to reduce the number of people that you're around. Okay? It makes it very difficult if you're in a party of 50, 60 people and 100 people, and then you're walking around asymptomatic but spreading the virus. So I want to see all of those things take place, but I want us to be intentionally focused today, July 21st, July 22nd, July 23rd, in putting on these masks and staying away from people.
From Channel 2, a BYOB strip club in Southwest Side is operating in the open and was packed this weekend. It's BYOB, so it's not subject to TABC regulation. Is this a problem? And if so, is that an unlevel playing field for local bars?
Well, you mentioned BYOB strip clubs that are operating outside, for example, of the governor's order. And these BYOB clubs are bringing the BYOB coronavirus called COVID-19 right there with them. Look, there is no substitute for individual responsibility. We can talk all of this stuff all day long. But if people ignore the science, the medicine, the advice that's being given, and simply want to be irresponsible, you know, that's unfortunate. That's unfortunate. But I do think it's important for people to be very respectful of others, as well as to be respectful of themselves. And so I do know that there are people that are gathering. I don't know if we have the occupancy limits on that. Let me yield to Chief Pena.
Thank you, Mayor. And the Mayor's exactly right. Look, we can't be at, the Fire Marshal's office can't be at every place all the time. And it does come down to personal responsibility. But when we do show up, we do ensure that we are talking to the business owner through the process to ensure that they come into compliance with the governor's executive order. But in the end, it is the responsibility of the business owners to provide a safe environment for their patrons. And it comes down to personal responsibility for the individuals frequenting these locations. We are certainly have a good working relationship with the TABC, and we're referring those businesses that do not or refuse to come into compliance with the governor's order. We refer those administratively to the TABC. Even not only the red tag ones, but now the blue tag ones are being referred to TABC for whatever administrative action they're taking, and that was as a request from the TABC. Okay, so that's an additional tool, I guess. But in the end, as the Mayor mentioned, it comes down to personal responsibility. Wearing your mask, physical distancing, and proper hygiene is going to ensure that we're limiting the spread of this virus.
Since you're up there, Chief,
Yes, sir.
I have a question from Channel 11. How do you respond to complaints that there is a delay in notifying firefighters, EMTs, and paramedics that they had contact with COVID-19 positive patient, specifically after hospitals notify the city? It is allegedly taking 7 days or more to notify those employees, potentially putting their coworkers and the public at risk.
Well, if you can give me specific instances, I can look into it. But I'm not going to speak to a hypothetical. What I can tell you is that we, at the Infection Control Office with the fire department, is we depend on the information that come in from the health department, from the hospitals, from other agencies. And the turnaround in notifying those personnel, especially the ones that need to be quarantined, right, is almost immediate. But if you can give me the specifics on those instances, I will certainly run that information down and see if there's any issues. What I can tell you is that anybody that needed to be quarantined or needed to get that notification is getting that as soon as we get that information and sift through that data. It's almost an immediate turnaround on that notification for our members.
Thank you. Mr. Mayor, I had one more for you.
Sure.
From the Texas Tribune.
Sure.
97 mayors in Texas signed a letter last week asking the congressional delegation for financial support from the federal government. What would you, as the mayor of Texas' biggest city, like to see in a new possible package of benefits for cities that didn't see in the CARES Act?
Well, you know, cities of those with a population of 500,000 or more did receive some funding the first round in CARES Act 1. And that specifically was for testing, contact tracing, things that were specifically related to the coronavirus. Cities, whether 500,000 or more or less, did not receive any funding for a loss of revenue as it relates to the coronavirus. And so our funding levels are being stretched thin. Earlier, for example, we talked about delays with our municipal employees in solid waste collection, even with police, with fire, a number of other services across the board. And so what cities, counties, local governments, even states, what they're asking for, and I signed that letter, one of 97, we're asking for direct assistance for states and local governments, okay? Not for things like pension measures, none of that, but as a result of lost revenue, as a result of coronavirus itself. We are the infrastructure that supports the public and private sector, and at this point in time, we are needing direct assistance. Oh, and let me just, before I said, because what's also tangentially related to that, for HPD, there are 190 police officers that are in quarantine, 142 have tested positive, 48 are waiting results. So I wanted to give that measure as well. And when that takes place, and when we have to call in either police officers or firefighters or municipal workers to step in, that becomes an added cost on our city governance and operations.
And the military has gone to some form of a private hospital. That is very worrisome to some of us. So we are interested in the dynamics, how that decision was made. How is it going to benefit the city? Was that done with the intention to benefit this private hospital? Could the military have been used to build new ab initio facilities on the ground? Those are the discussions that we are interested in, besides the fact that you keep talking about people going to quarantine, knowing that there are differential diagnosis issues as you were taught maybe in the medical school. So I don't expect the citizens to know what they are dealing with, whether it's the flu or whatever, it's the virus, and they're going to quarantine without having the test. Can you actually explain these issues? Thank you.
Okay, so you asked two questions. Let me first address the question of the military. The military installation is just using the property. That UMMC is where they are presently, and UMMC is not benefiting from that at all. They had an empty wing, so instead of having to build a hospital, there was an empty wing that was not being used otherwise, and it was convenient for the military, and that was what they asked for, was someplace like that. Remember also, the patients that are going to be treated there are those that are being transferred from other hospitals across the region. So UMMC, while it may be a private hospital, is not independently or disproportionately benefiting from the military being there. Now, your second question about differential diagnosis and other causes of symptoms. So this is one of the reasons why testing is so important, and for most of the tests that are being done in hospitals that we are getting rapid turnarounds because we're using local labs. The local labs are getting us answers within about 48 hours. It's only the national labs that are taking a long time. Now that's still a large percentage, and that's why we hear the complaints, because we're getting so many tests are being sent through. At each of the two, at Del Mar and Butler, for example, each of those is 650 tests per day, and so that's a large number of tests per day. But the local labs are getting the results quickly. So if somebody comes in with symptoms, and again, at this time of the year, people with fever, difficulty breathing, body aches, viral syndrome symptoms, at this time of the year, what we're finding is that their flu isn't here yet. Rhinovirus, the cold virus, it's not here yet. So clinically, it's easier to make that diagnosis backed up at the lab. The challenge will come in the fall or after school opens and we have kids gathering together, because that's when viruses, all of the other viruses, respiratory syncytial virus, and the para-influenza viruses, that's when those start circulating. And at that point, making the clinical diagnosis will be very difficult. And we know that with the current PCR tests for coronavirus, it's very accurate. But as we all know, the standard bedside, the traditional bedside influenza test is not terribly accurate. So we're going to have to rely on formal laboratory testing. And could it be possible somebody could have both influenza and coronavirus at the same time come this fall? Absolutely. And that's going to make it doubly difficult, A, to diagnose, but B, to treat. That person will have two active viral infections at the same time. So I'm a little afraid. I'm not a little afraid. I am afraid of what that may mean for us from a clinical standpoint.
Dr. Peirce? I have two more from the pool, please. How do you explain the declining number of COVID-19 hospitalizations at the Texas Medical Center while the number of daily positive cases continues to rise on a 7-day average?
Yeah, that's a great question, one that we're kind of struggling with. So one thing to keep in mind is that when you look at the TMC data, that is the Texas Medical Center member institution hospitals. That's all of the Memorial Hermann hospitals throughout the region. That's all of the Baylor St. Luke's, Houston Methodist hospitals, but it's not all of the hospitals. When you look at the SETRAC data for just Harris County, we're not seeing the decrease. We're not seeing the drop-off. It's kind of leveled off. The rate of increase has slowed quite a bit, so we are seeing some improvement there. And you're asking a really good question for which I don't have a great answer. The virus is spreading. Our positivity rate remains high, but the number of people requiring hospitalization seems to have tapered off a little bit. Now, there's a couple of things that may be contributing to that. The one that I think is probably got the most validity is that the hospitals are doing a better job of caring for these patients. We're learning about this virus. We're learning what works well. So the length of hospitalization for patients may be getting, in fact, I know it is getting shorter. So as that, the length of hospitalization gets shorter, we're discharging folks more quickly, making bed space available. And that's how this would reflect in the daily counts, is that if people are going home sooner, they're not staying in the hospital as long, therefore that vacancy is going to come in and offset. I think, but I can't say for certain, but I believe that that's what we're seeing is happening.
One last one. The medical center's hospitalization stats from the last few days seem to be moving in the right direction. What are your thoughts about the latest data?
I think I just gave it to you. I think this is good news. I think that the virus, this is no reason for us to take our foot off the brake, however. That's probably my biggest fear, and the mayor and I have discussed this. My fear is that anytime there's good news, I don't want people misinterpreting that we're winning the battle. Right now, we're kind of at a stalemate, and if we want to win this battle, we need to keep doing everything that we do that we know works. Wear the mask, no large gatherings, wash your hands, etc. Those things work. But right now, and the other analogy we said is that, we're driving the school bus. I'll use the school bus analogy because I got school. We're driving the school bus. We're not accelerating anymore, but we're still going 100 miles an hour. Right? This is not the time to take your foot off the brake. There's a curve coming ahead. This is not the time for us to take our foot off the brake. Do not misinterpret good news as great news. It's good news because what we're doing is working. We need to continue doing what we're doing that's working.
Thank you all.
One last thing, and in response to the Texas Monthly question that you posed, the letter that was signed by 97 mayors coming out of Texas, the impact of this virus from an economic point of view is going to be around for 2 to 3 years. So it's not like the impact will leave the end of this year. So cities and counties, local governments are going to be impacted financially, economically by this virus for another 2 to 3 years. And we have to plan accordingly. And so that's one of the things that we've asked the federal government to take into account. The other thing is that we've received a number of requests for rental relief. And so we're asking Congress, for example, in their next package to include rental relief, also as a part of the stimulus. And so that's important. And then our hotel, hospitality, and tourism sector have been hit very hard. And so we're asking them to take those things into account as well. Okay, so let me thank you again. I do want to thank the people in the city of Houston, people and businesses, those who have complied with the requests that we have been making to you almost on a daily basis. I want to thank the people in the city, for example, who are putting on their masks. I want to thank the businesses who have been very cooperative and very responsive, because quite frankly, even with the somewhat of the ease of the reductions in our hospital to some degree, that would not be taking place without a lot of people within our city working and doing just what we have asked them to do. I'm going to ask you to continue to do it, to be very intentional and focused over the next several weeks. And if we do that, I know we can not only we won't only flatten the curve, but we will reduce it as well. So please, please continue to avoid large gatherings, these backyard parties, swim parties, these BYOB parties. You know, please avoid all of that, and just know where you're going. Just know where you're going, and if you do that, then I believe we'll continue to see some modest improvement as it relates to this virus. Thank you also very, very much, and we'll meet again soon. Thank you.
And once again, the mayor and the city of Houston with a coronavirus update. The city reporting 884 new cases, 7 new deaths, bringing the total to 329. Also, 2 public works employees have died per the city. The city emphasizing this as well. All fire stations are open, despite posts on social media claiming otherwise. Much more on the coronavirus and its impact on Houston in minutes on the 411. Now, back to Ellen.
Delivery. Cooking 3 meals a day?